when we see the versatile groups of materia medica, it becomes very essential to know that how to study materia medica, because there are variety of groups, variety of types. As per example, comparative materia medica or physiological materia medica, or new generation materia medica, or the drug pictures kind of materia medica, or clinical materia medica, therapeutic materia medica. There are variety of materia medicas, and whenever we read one, we see that there is a lot of difference between the other. So that's why, in students, and also in the PG curriculum students, and in all these kind of students, there is a lot of question that how to study materia medica, or which is the right way of studying materia medica. I think that we can say that we have studied a medicine only and only when we become familiar with it. It's not all about only studying the materia medica. It's actually all about studying a medicine. It's actually all about understanding a medicine from variety of dimensions. But the problem with all of us is probably that we always try to look at the size of the book, the applicability of the book, and then we keep reading it. And we try to mug up the symptoms from various clinical materia medicas, or various new generation materia medicas, or various comparative materia medicas. But don't forget that all these kind of materia medica, as for example, it may be Allen's keynote, it may be Boric, it may be Dubé's materia medica, it may be Phatak materia medica. All these materia medicas are the end result of the exhaustive work done by that particular author. Dr. Allen sir has read a lot in the hearing guiding symptoms. In all the provings done by Dr. Herring, he read all the materia medica pura work. And then after all these knowledge of those source books, he did a lot of clinical experience. And at the end of it, when he found clinically verified wonderful symptoms of some medicines, he made keynotes out of it. And then he has given a wonderful work as Allen's keynote. Or as the same thing is being done by Boric sir with a different books, or different culture of books, or different culture of reading done by him. So the point is that all the materia medicas of a keynote kind, of a comparative kind, or of a drug picture kind, or the new generation materia medicas like Dr. Shankaran sir has given Saul, or the variety of other books, Vijay sir's book, Saigal sir's repertory, rubric interpretation books. All these are actually the end result of the exhaustive work done by them. And when we try to mug up the symptoms from those works, it's very obvious that that most of the time we are going to, or we tend to forget that work within a very short span. And the reason again is, I'll again come back to that statement of mine, that we need to become familiar with the medicines. And Dr. Phatak sir says wonderfully, I didn't remember in his quotes, I think I'd like to share it in future. But what he wants to convey is that medicines should become like your friends, that you see from any angle, you are going to identify them. But the problem with us is that we don't look at them like having a familiar thing, but we keep looking at it as if we are reading, or we are trying to mug up some symptoms. It's not only a combination of symptoms. I would like to here note again the sources of materia medica. The sources of materia medica is not only the work which is done by various authors. The sources of materia medica includes the habitat. The sources of materia medica includes the toxicological properties of the whatever medicine we are reading. I think that we all know it very well, but I would like to again repeat few of them. That is, we know that it's all about proving on healthy human being, proving on animals, proving on various plants, their toxicological properties, physical properties, chemical properties, medical use, non-medical use, its empirical use, its traditional use, all these kind of things, its habitat, its doctrine of signature, all these kind of things make first this substance familiar to us. Then when we see or when we read the source books, we get more idea regarding the proving part of it, the proving symptoms part of it. And then when we go through a final materia medica like Allen's keynote or Fatak's materia medica or Borik's materia medica, we get the concluding work, the clinically verified work, the applied part of it. But reading only applied part misses a lot. It's like I think iceberg phenomena, what we have, that only 1/3 part is above, 2/3 is beneath, and that is the base. So I'll say here that the question should not be how to study materia medica. The question should be how to study a medicine. And a medicine should be studied or should be started to study through the basic familiarity with the substance or the source from which it is being made up of. Most of the things, most of the symptoms we get clearer when we study the real medicinal part of it, the real source part of it, the real substance part of it, or the real part where the properties of that substance are being described. As per example, we know very well, that just before a few days we were doing some casework with sickle core, and we were very well knowing, that sickle core is basically a fungi, and which is used as a ergot, and which is a basic abortifacient. But instead of understanding the basic ergot part and its active principles and its toxicological properties, what we try to do is we just try to mug up sickle core from some materia medica. And then we get confused between sickle core and ustiligo, we get confused between sickle core and the other third month abortion medicines. We get because we are not familiar enough with that particular substances. So for all the students who want to start studying the materia medica, I'll say them that just do a bit more exhaustive work for few medicines at least. You can't read all materia medica right at a first instance, but for at least for few medicines, you start with being familiar to the substance. First, read the substance from, or read that particular source from the general books. Get the idea that which is the real active principle in that particular substance. Which are the toxicological properties of it? Which are the accidental things which happened in the history? And then you get the idea. I remember one very wonderful story in that regards, as per example, that there is even a story in Plumbum Metallica that in the ancient time there was a king in Greece area, in Greek culture, and he thought of that we are going to give the tap water at every home in the state. And that was very newer concept at that time, because people used to go to rivers and they used to get So what he did is that he made the pipeline in the whole state. It was first time ever in the history of mankind that the water was directly reaching to the in the house or in the home of a person. So he made the whole pipeline, but then the chemist at that time told that this is made up of iron, and which is going to be very soon it is going to be deteriorated because of the water inside. So it won't last long. So he told that you can do one thing, we can make some coating over that iron. So what they do is that they did a coating of lead on that iron. Even today we do the same color on the any iron stuff. So in the same way they do that on the whole pipeline. They coated it with the lead, and then gradually things started happening in the state that the people started getting recurrent pain in the stomach, recurrent abdominal troubles without anything in any outside triggering factors. Gradually there were few people who developed severe constipation, and gradually there were few people who developed severe muscular weakness, and they became that weak that finally they died out of that muscular weakness. And then when the post-mortem studies has been done by the physicians at that time, they found that there is a lot of amount of lead which with the water they were taking, and then finally it was the resultant effect of it. So these kind of stories will give a lot of idea that okay, nowadays we all know that plumbum metallicum, the basic symptom is the colic in the abdomen. It's the best medicine for constipation. It's the best medicine for the diseases of a neurological origin, and especially motor systems are getting affected because of the plumbum metallicum. So all these things, if we go and mug up in the materia medica, we couldn't. But these are the things. The another benefit of studying the medicine in this way is that it expands the basic knowledge. Just yesterday there was in one case discussion we had a talk that if we give immediate thought on lithium carb, if any homeopathic student will think about lithium carb, unless if they read the newer provings done by NSHAD, that's a different story. But if a person goes with a old materia medica or our basic materia medica, so the moment lithium carb comes, it comes in our mind that it's the best for uric acid diathesis or rheumatic diathesis. It's the best medicine for the distal interphalangeal joints. So many type of RA and all these kind of complaints, urinary troubles, lithium carb is the best medicine. But now if you study lithium as a substance, we'll find that there is a lot of medical use, especially in the field of psychiatry, where for all the schizophrenic or psychosis people, or for all the psychiatric complaints, most of the time, or neurotic complaints even, most of the time psychiatrists use lithium as a medicine. So now obviously it's an important addition which we can make in our materia medica. But for that we have to have that general knowledge regarding the substance. So to study a medicine, the first step is to become familiar with the substance or a source from which the particular medicine is being made up of. This is the first step. And then the second step is to read the proving, the background of the proving from variety of source books, mainly Materia Medica Pura or Herring or Allen's Encyclopedia. Just try to see that which were the potencies in which the medicine was being proved, because that will give you a lot of idea that how many toxicological symptoms are actually there or how many dynamic symptoms are actually there. So first thing is that you need to become familiar with the source. The second step is you need to read a proving, the real proving, the raw proving. And then the third step is the materia medicas, like Elensky note or Boric or Clark's work, which is a wonderful work, or Kent's Materia Medica, or and the final step is to read the new generation Materia Medica, or to read the drug picture Materia Medicas, because it gives the only outline of that medicine, the macro picture of that medicine. But to study a medicine from source to new generation Materia Medica will give us a complete idea, or an idea in the totality. And then I don't think that we can ever forget a medicine in our life. So I think that's all I would like to say regarding how to study a medicine. We'll keep discussing few other things as well, but I think for today it's only about how to study medicines. Right?